Hi, my name is Alannah Crozier, and I'm applying to Jefferson as a pre-nursing major. So throughout my scholarship day, I looked at the case of Jaden Liebi, a football player who ultimately became paralyzed due to an injury on the field. So throughout the case, you heard from a lot of different specialists who helped Jaden in the hospital. But throughout all their encounters, when they mentioned Jaden, they associated him with a positive attitude and having drive. And I think this is a really meaningful factor because when you're going into a hospital and when you go through something as traumatic and hard as that, it's really hard to stay positive. And not only does that slow down treatment because they're having to work through some extra stuff, but it's also really hard to get a patient's drive up. So it was amazing that he was just able to keep it going and to refocus himself and find a goal, which his goal was walking. So throughout this situation, I decided to look at the perspective of a nurse because that's what I want to be. But when you're thinking of healthcare positions, you need to be thinking of a team effort because when you're in a hospital, a nurse does not treat you. A physician's assistant doesn't just treat you. Everyone works together to create a plan and to treat you together. So through this, I kind of viewed the nurse as the advocator and the connector between different medical technicians and different medical positions. So going through his case, he obviously first got hurt on the football field. So the athletic trainer and the EMTs were the first to see him and to see what the next steps were. They took him to the hospital, and there the athletic trainer and EMT had a talk with the nurse, giving quick vitals, saying what happened, and just giving a brief synopsis of everything a nurse would need to know to help move on to the next step. Then, because of this case, Jaden had to go into immediate spinal cord surgery. So at this time, they looked at his brain, they looked at spinal cord, and they took out some fluid. Now, this fluid was sent down to a medical lab where biotechnicians and medical laboratory scientists looked at it and examined. They would see in cells if there's anything that could possibly help him or possibly harm him in treatment. They would look to see if there's anything that is concerning in the blood, and they would also see if there's any medication that would be good for him to treat. Now, with this knowledge, they would upload it to the portal, and a nurse would see this, and she would be able to advocate for what medication it was so that he can hopefully get better. After he comes out, he will most likely be taken down to medical imaging. There, a radio tech would take scans, CT, MRI of his brain to see what areas look like. If there's an issue in the prefrontal cortex, he could be paralyzed, which is what happened with him. So when he got surgery, a respiratory therapist also would have helped. She'd probably put him on a ventilator so that his lungs didn't have to do a bunch of hard work, because they were working on his brain, and the brain controls your breathing and all of that stuff. They just want to make sure that he can keep going. So respiratory therapist would put him on that, but the nurse is going to be measuring vitals. So she's going to look and see, hey, he's not breathing right now, or like his oxygen levels aren't good. And she's going to detect this, she's going to treat it, and then if need help, she's going to contact a respiratory therapist. Next, when he gets out, he's going to need pain medicine and medicine to treat his thing. So that's going to go through pharmacy. But in order to deliver that medicine, it may be through an IV, which a nurse would push, or it may be orally, which a nurse would manage and give. She would also look out for signs of a medicine not working. So if there does seem to be harm, she would identify it and then get him off that medicine. Next, a nurse and a physician's assistant will work together. They will create a treatment plan, find out what goals they're willing to hit so that he can get out of the hospital. Now, going through an event like this is very traumatic, and it's a lot for the patient and it's a lot for the family to go through. So there's going to be a counselor there who's able to talk through a lot of the hard stuff. But a counselor can't be there for most of the time. The nurse is usually there. So the family is going to form a connection with the nurse. She's going to be able to talk to them and just get to know what they need and help find avenues where he is able to heal and get better physically and mentally. A dietitian is going to come in and help him retain muscle mass and his immune system as well, so the nurse is going to implement these plans. Along with this, an exercise scientist, an occupational therapist, and a physical therapist are going to work together, create a plan, help treat him, but the nurse is also going to implement this plan. Now, a nurse can take a role outside of the hospital, becoming a home nurse, where she can help do diet, she can help exercise, she can just really treat him. So throughout this, the nurse is the advocator and the voice with medical knowledge. She's able to tell them what is needed and to provide for the patient. So through this, I just really think it's important that you don't think one medical role is like more important than the other, because every single person works together to help treat his case and just wants him to get better. So that is my perspective on Jaden Leaby's case. Thank you.